Assalamualaikum warahmatullahi wabarakatuh and salam sejahtera. I am Ruzani Fakosnin from the Faculty of Hospitality, Tourism and Wellness, University Malaysia Kelantan. We'll be presenting our research entitled Coping Under Pressure, a study of mental well-being among UMK lecturers. According to UK survey by Education Support 2023, 78% of educators experience stress at work, with high rates of burnout and sleep issues. It is known that high stress among academics would potentially reduces productivity and satisfaction, while adaptive coping strategies like problem solving and social support improve resilience. Maladaptive strategies could worsen mental health. Therefore, this study would like to investigate how different coping strategies relate to mental well-being of university lecturers. The research objectives of this study is to investigate the relationship between four coping strategies, namely problem-focused coping, emotion-focused coping, avoidance-focused coping, and religious-focused coping towards the mental well-being of lecturers at the University Malaysia Kelantan. This is the conceptual framework of the research, where problem-focused coping defined as a activity proactively seeking effort to alter the stressful event, while emotion-focused coping regulate the negative emotional responses by seeking social support, such as talking to friends or families. The third one, avoidance-focused coping, is minimizing stress by denial or mental distraction. And the fourth one, religious-focused coping, where individuals apply religious practices such as prayers or religious gathering to reduce the stress. So the dependent variable mental well-being is defined as the capacity of individuals to reach their greatest potential through creative and productive manner for the benefits of their community. So this research is actually want to investigate the hypothesis relationship between the four independent variables toward the dependent variable. This study used cross-sectional self-administered questionnaire survey as the research design. The population of the study is the lecturers at University Malaysia Kelantan. Using census sampling method, all 535 active academic staff were used as sampling size. Data were collected through UMK emails and analyzed using SPSS for descriptive reliability and correlation analysis. Research instruments were adapted and adopted from Line and Roger 2000, Carver et al. 1989, Raya et al. 2008, and Tennant et al. 2007. 5-point Likert scale from 1 strongly disagree to 5 strongly agree was used to measure all items. The research finding shows that the data collected was 237 with 44% response rate. The majority of the respondents were female with 61%, Muslim, married, and mostly in 31 to 50 years old with 70.5%. Matured academicians in the age above 50 also included in the data. Majority of lecturers has been working at UMK for 3 to 10 years. Academics from all 10 faculties had answered the survey, making this research generalizable to UMK academic staff. Based on this descriptive and reliability analysis, we've seen that religious-focused coping was the most used strategy with mean value of 4.62, reflecting strong spiritual reliance, followed by problem-focused coping with mean value of 4.4, emotion-focused coping with mean of 3.92, while avoidance-focused coping were less common with mean value of 3.26. Overall, respondents reported moderately high mental well-being with mean value of 4.30 with feelings of optimism, connection, and self-positivity. Factor loadings exceeded 0.69 for all items, and Cronbach alpha values range from 0.85 to 0.94, confirming the robustness of the survey instrument and its alignment with the study's objective. Based on the correlation analysis, all four hypotheses tested in this study were supported, with significant p-values for all relationships. Problem-focused coping had shown the strongest positive relationship towards lecturers' mental well-being, followed by religious-focused coping and emotion-focused coping. However, avoidance-focused coping, although significant, was found to have the weakest positive relationship towards lecturers' mental well-being. So this study indicates that UMK lecturers use problem-focused coping as their main coping strategies when they face with stresses. This result indicates that individuals who take active actions to manage challenges tend to enjoy better mental health. Aligned with previous studies by Abdel Khalik, 2010, religious-focused coping had a strong positive association which highlight the importance of spirituality and managing stress, particularly in Muslim populations. Emotion-focused coping showed a moderate positive relationship with mental well-being, suggesting that expressing feelings and seeking emotional support contributes to psychological stability. Finally, avoidance-focused coping exhibited a weaker positive relationship. Although this strategy may offer temporary relief, its lower effectiveness indicates that it should not be overly relied upon, as it may impede long-term well-being. Some limitation of this study is the use of cross-sectional design due to the inability to establish causality, susceptibility to selection bias. Secondly, the UMK-only samples may limit generalizability of lecturers in other higher education institutions. Thus, future studies should include other research designs and academicians from other education institutions. In conclusion, this study investigated the relationships between four coping strategies and mental well-being of UMK lecturers. The findings revealed that UMK lecturers generally experience moderately high positive mental well-being, with problem-focused coping being the most commonly adopted strategy during stressful situations. The findings stress the importance of work-life balance and effective coping for academic and personal well-being. With that, thank you very much. Assalamu alaikum.